We are here today with Dr. Kiourtsis, and he's going to tell us about his history of his practice.
Sure. Our office started in the late 60s. My father started the practice then, and I joined the practice in 1992. We opened our office here in Hilliard in 1994.
Okay.
Question two then?
What inspired you to become an orthodontist?
I think my father had a lot of input in that. Just growing up in a dental family had a lot to do with it. Coming in the office, working in the summers, helped out a lot. Just watching patients kind of transition through treatment and watching their smiles grow.
Microphone under your chin.
What makes your practice unique?
Well, our practice has been in the community for a long time. We are really into technology, getting into Invisalign quite a bit, trying to straighten teeth with an invisible appearance is key. Technology's played a huge part in our office.
Has there been any recent advancements in your field?
Sure. Again, with Invisalign, we now have three-dimensional scanning, and that has been a huge improvement. We don't have to take those nasty impressions of teeth anymore. We can digitally scan and have a very accurate impression.
What are some warning signs that a child may need braces?
Well, some of the things would be just appearance, and that's a personal thing. Some people don't mind having crooked teeth, but a lot of people will see a tooth out of position, and that's one sign. Other things could be pain in the jaws or pain in the ears, which might mean that we have a bite issue.
Okay. Can the need for braces be prevented?
At times it can. It's hard to predict if you can prevent it. We do a lot of early treatment, some expansion to create room for teeth, allow teeth to come in a better position. Then you just have to kind of wait and see what happens. Probably 80% of the time, though, when we do an early treatment, patients will move on into a secondary treatment. Occasionally we get some lucky ones that don't need to move on.
How much part of your practice is educating your patient?
A lot of the practice is educating patients. When we get into treatment, we need cooperation. Cooperation from brushing, so we do a lot of discussion about hygiene and toothbrushing. We also educate patients on wearing elastics, and trying to motivate them is a big part of the practice.
Can adults get braces?
Sure. Adults, probably about 20% of our practice are adults. They range anywhere from late teens, and probably the oldest patient we have at the moment is, I think Martin's probably 87 years old right now.
Okay. Yeah. Do you support any community or charitable activities?
Sure. We always do a candy buyback after Halloween, and that supports the military, and we do that locally here with a group. Yeah, so the name of the group, I should have looked that up.
If people would like to learn more about your practice, how can I do that?
So you can come in for an appointment if you would like. You can also go online and look us up at www.Kiourtsisortho.com. You can also check us out on our Facebook page and our Instagram page.
Thank you very much, and thank you very much for your time today.
You're welcome. Thank you.
This is Amare Jenkins reporting for the Hilliard Digital Club Media.